Hey Ivy, my name's Quentin. I'm going to be your student nurse today. The doctor has a couple things ordered for us. We have to do a NG tube, which is a nasal gastric tube. So what that is, it's a small little tube. I got the smallest one I can, a little bit more comfort. This is going to go through your nose and down through your esophagus, which goes all the way to your stomach. This is going to help you get some more of the electrolytes and some of the protein and all that you've been missing since you have nothing by mouth at the moment. And then also I have to do an IM injection to help with that nausea and vomiting. All right, Ivy, can you tell me your last name and date of birth?
Ivy Armstrong. My birthday is 3/9/64.
All right, perfect. I have a couple questions for you. Are you allergic to anything, Ivy?
Just latex.
Just latex, okay. And then also, have you ever had any facial fractures or any issues with your nose or
No.
nasal cavity?
No, I don't think so.
No? Okay, perfect. All right, so first off, I'm going to start out with that IM injection,
All right.
which the doctor ordered 4 milligrams of Zofran, which is the anti-nausea medication. We're going to get that going first before we do the nasal gastric. That way we can try to help some of that nausea.
All right, sounds good.
We'll wrap around here. Let me get everything set up. So, I did my first check of the MAR. So I have, it's 4 milligrams per milliliter. So I'll be pulling 1 ml of medication. And it is for Ivy Armstrong.
I know.
Some of this other stuff away.
You know, as much like a sanitary is better. So, you know, what are you doing hard? Like, do you think like you need to like it? Because they're never gonna judge you for like you put your hygiene. Remember when you so do whatever you do.
I cleaned this for 30 seconds. 28, 29, 30. Boom. I'll pull back a mil. Mil there. This is a reusable vial here. I got a mil. Alright. A mil. Oh, the mill did not go through. Probably a new vial. There it goes. I got a mill and med there. Alright.
Yeah, can you just please blow?
This out. So I got 1 mil, which is also about 4 milligrams of Zofran. I'm gonna go ahead and cap this. All right, we get another alcohol swab. Is it okay if I go ahead and put this shot in your shoulder here in your deltoid muscle?
Yeah, that's fine.
All right, perfect. Clean this in and out. Also 30 seconds. All right, we're gonna let that dry there. While I do that, I'm gonna raise your bed up. Also gonna write this down too. Alright, that should be dry by now. I gotta get this partially open. It is right to the sharp. Go right on. This. Clear all the ears out. Perfect.
We don't have it, so for the sake of it.
All right, are you ready?
Yep, I think so.
Kind of pull that skin back. All right, here we go. Perfect. Pull that out. Straight to capping the needle. And then toss the needle, saving that for lab purpose. And then we're gonna get some gauze. Alright. If you can, I'll have you hold that there for me for a sec. Okay, I'll grab some tape. Perfect, thank you. Tape going. Thank you. Just fold it up for you. Alright, get you all taped up, okay?
Awesome. Thank you.
Alright, let me get some of this trash out the way. I'm gonna change my gloves here in a sec, and then I'll do a little slide assessment real quick before we go ahead and get this tube in, and I'll just kind of check your stomach and see how the bowel sounds are going. Check a couple other things
Alrighty.
before we get all that started.
Sounds good.
Awesome. Alright. Gloves. Back around.
Oh my god, it did not morning. No, maybe we can play some cards though. Maybe some food after.
Alright, again, I still haven't had, just want to make sure, jog your memory, no facial fractures or anything that you know of.
What?
No.
Sorry, what?
No facial fractures that you know of or anything?
Sorry, no.
Okay.
No, I'm good.
Just checking. Alright, bring this over here. I'll drop this back down. Alright. You alright if I go ahead and expose your stomach for a bit?
Yeah, that's fine.
I'm gonna drop this down.
Bye bye.
Down.
Okay. Bye.
Alright, so I'm just gonna go ahead and listen to each quadrant real quick and then I'll palpate. Now listen to each spot for a full minute.
No, you're not. You're not.
I'm gonna go up.
Guys, I know this is like.
We had normal active bowel sounds. This up. And then I'm gonna just take a little feel. Alright, everything feels good. Stand. Jake might cover it up properly. Alright. Get you seated a little higher here. So I have to have you sitting around 90 degrees here just to help get that tube down. I'll bring you up here. There we go. Alright. There. Alright, so I'm gonna use this to check inside your nostrils to see which side's more open. From what I can see. Alright, and we're also gonna use a tissue here to see which side might be a little bit more comfortable for you. I'll have you go ahead and blow for me. Blow out the nose. Then blow out this side. Do you have a side that felt a little bit more comfortable? A little bit more open?
They both felt about the same.
About the same. Okay, I'll go ahead and use this side, your right side. Toss this. now, the right side. We're gonna switch gloves here.
Because they need to keep waiting. I can get it if you that's very good. I'm telling you that because I practicing.
Keep trying to get harder to put on.
Like X-ray, the person
All right. I also need to check your gag reflex as well.
that's what you
I have a little tube here, a little tongue depressor. All right, so I'm just gonna go ahead and check your gag reflex. Are you ready?
Yep.
All right. Okay, so it's good. Good gag reflex. I'm gonna go ahead and switch gloves again, just make sure my gloves are nice and sterile. All right, I'm gonna go ahead and I'll get everything set up, and we'll try to get this over with as soon as possible. Okay?
All right, sounds good.
That's what I was trying to understand why
And then I'm just gonna place all my supplies on here. Which I already have on here. I won't be leaving you.
So before doing that, right? Before doing that, right? Yeah, so after that, gotcha. So this one's go after that.
Tape prepped.
Yeah.
Up here. Tubing. Make sure we got everything else. Perfect. Okay. So, I'm just gonna put this to the side of your face here just to make sure I get the right length that I need here. And grab another piece of tape as well. I'll take this by your nose here. Come back to the ear.
So I have.
I'm gonna have this stretch it out. Perfect. So I got 53 here. Right there at that mark. To the outside of that tape. All right. So that. Using this as the anti-reflex for now. I'm gonna go ahead. Everything lubed up. I'm gonna get a towel down as well. Get you. Nothing gets everywhere. I'm just gonna get this tucked in here, okay? Perfect. All right, so for this, I'm gonna have you tilt your head back to start, okay? I'm gonna move this pillow out the way to give you a bit more mobility. Perfect. Set this off to the side here. And I'll put it on this side. There you go. I'm just gonna spray this I would not do this on the patient, but. Perfect. All right, so this is gonna hurt a little bit, okay? It's gonna be pretty uncomfortable at first, but we're gonna try and get this going pretty quick, okay? All right, so we're gonna have you tilt your head back for me. All right, oh, the nostril, down to the throat. All right, now I'll have you put your chin to your chest, okay? Keep feeding this through, okay? Doing all right?
Yeah.
Okay.
It kind of feels weird going
So
down the throat.
I need you to take some of this water, and we're gonna help. This is gonna help it go down your throat. Just gonna take some sips, okay? Put the head down. Goes. All right, all good there. About to our mark. We'll get this secured. Goes there. And then this wraps. One wraps around the other. All right, I'm gonna say that's secure. That's there. I have my reflex stopped. All right. So now we have to also confirm that it's in the proper place with X-ray. While I'm waiting for X-ray to come up, okay? I'm gonna check the pH real quick. So,
Alrighty, sounds good.
all right, we're gonna get syringe here. Undo. I'm just gonna take back about 5 mils. And this is also after X-ray confirmation to confirm. So, pull back 5 mils. Uncap. This back. And test the pH. Put it into a basin here. Just to the side.
Safety on and then put it in.
Alright, got a little pH test strip here.
Especially if they're tense.
We're looking for anything between 3 and 6. It's more acidic.
Extra.
I'm just gonna lay this here. Give that time to soak up. I'm gonna go ahead also kind of take this off to the side, kind of up there, kind of out of the way before we go ahead and get some of that feeding started. Okay, everything still feel okay?
Yep, so far so good.
All right, so we're gonna get all that confirmed with X-ray. Checking the pH.
Okay, I just like to try to do the part.
pH seems to be close to 3, on the more close to the orange, which looks good. That's a good sign. I'll let the basin go. And this is what we're going to use to go ahead and collect any gastric juices. We're going to have our pump up here in case they need have that ordered by the doctor later. All right, this over here. All right, get some of this trash out the way. So I go ahead and lean you back here. I got to keep you above 30 degrees. That way everything flows okay through the tubing, okay?
Alright.
I'll get this pillow back behind your head once I get you back. All right, we're going to keep you about there, okay? Is that comfortable?
Yeah, I think it's okay for
All right,
now.
let me lean your head forward for me real quick. Just tucked in. All right. I'll get you back a little bit more. Just get a little bit more comfort. All right. So all set up. All right, is there anything else I can do for you while I'm here?
I don't think so right now.
All right, sounds good. Get all this mess out the way. All cleaned up. I'll wipe this down. All right, go ahead. That's my gloves. Boom. All right, I'm gonna bring you down here, okay? there anything else I can do for you? Nothing else?
Nope, I think that's it.
All right, perfect.
Well, no, I'm not.
All right, we'll be back in about 15, 30 minutes, okay?
All right, sounds good. Thanks.